Representative Tharinger, the floor is yours.
Thank you, Arlene, and good morning, everybody. I think we'll just spend briefly a little time going over what we did last session, a little bit of thoughts of what might be coming up in our supplemental session starting January 10th. And then I think both Mike and I are really interested if you have any questions so we can answer those. So people can remember back a year ago, we had, challenges with the virus, which is still writing the scripts with the play we live in, which is challenging for everyone. But our budget situation was really, we thought, to be impacted by that. But because of what happened in DC with the recovery money, our budgets ended up being rather robust, both on the operating side and the capital side. And I should say, in the legislature, I'm chair of the capital budget in the House. I sit on the Appropriations Committee, and I also am on the Health and Wellness Committee. So those are the areas I focus on. But the operating budget, we did quite a bit of, funding for education, which is always a big deal for us, but a lot of it was COVID related. So we funded more counselors, tried to increase broadband devices for folks in the schools, K-12 schools, so that students could study remotely. We did a fair amount of investment in early learning, expanding the ECAP slots, early learning slots. And as folks know, daycare and slots are a big challenge across the state. Folks just can't find places for childcare or early learning. So that's been a focus both in the operating budget and the capital budget to try and create more space and more staffing for that. We did a lot of public health. Of course, we had to do a lot of put some dollars into testing and vaccine administration, and the pretty robust numbers, about 3.2 billion in that area. And also, I think COVID related, but just in general, operating budget investments in behavioral health. And also on the capital side, we put money in. There's a big effort in the state to try to get behavioral health issues addressed in the community. So we have community facilities that have the staff and the supportive housing or the supporting staff for dealing with those issues in the person's community instead of sending them off to a state hospital or a larger facility. Be honest, the state's way behind on this, but we're making progress and creating more units and more treatment facilities across the state to deal with that. And then for those that are in the business world, we provided about 700 million through the Recovery Act for unemployment tax relief and small business tax credit incentives. And then there was some small business grant programs. We also put dollars in funding, the tourism and marketing services, which we haven't been strong on at the state level, quite frankly, but that's obviously important to Jefferson County. And so starting out and kind of the governor had made some cuts in the budget we had passed before. That all changed, and we ended up having pretty robust budgets, across all categories, both in operating and capital. And in the capital budget, we were able to, we put a fair amount of dollars. We talked before, I think we started getting on, recording, and a lot of people got on, just the importance of affordable housing. And that's an issue that impacts every community across the state. And when we look at housing, certainly on the capital side, we look at kind of full spectrum of needs. So we certainly don't want people living in tents. So moving them from tents to what we call community housing or tiny housing, tiny homes or cottages. And there's some efforts going on here in East Jefferson, I think that are pretty effective. Then you can move into the aggregate shelter situation, although COVID has made that very difficult because of the spacing. And for some individuals, that just doesn't work. Then you can go to, I think the end game is to try to get to permanent supportive housing, where a person has their own unit and the services they need to get to get their life back on track and, become a working individual in the community that's paying taxes instead of being dependent on tax revenue services. And I think in our community in East Jefferson, there's really some strong efforts going on. I think I was actually on the phone this morning with Gary Keister at Bayside, who's doing some pretty amazing things. And we're working with, he's got a project that he's hopefully will be able to provide some funding for in this supplemental budget to help him purchase a motel in Hadlock. And that's one of the things, one of the categories we stood up this year was a rapid response category. It's very challenging, as folks, anyone who's trying to do any sort of building project knows, to get the supply chain is a huge challenge, and finding workers to do the, subcontractors and other workers to do that, the needed work is a challenge. So we're focusing dollars on what's called rapid response. So if there's an existing building that can be transitioned into housing, that we don't have to build new units, that's a lot less expensive, and it gets those units in use a lot quicker than if we had to build from the bottom up. I think we put about 70 million in that account in the capital budget, and I think it would, the requests for those funds through Commerce were about 120 million. So this is maybe a way for us to transition into what's coming up in the next session as far as adjustments we need to make. And I'll speak to the capital budget. And Will, I know Will O'Donnell's on. I mean, one of our challenges, we've put over 400 million into broadband, and that's a huge issue in East Jefferson and across the state. But in discussions I've had with a couple of PUDs and other folks that are trying to promote these projects, fiber, to be able to get fiber to do a project is about 2 years out, about 80 weeks is there's just so much demand for the fiber. The virus has created supply chain problems. So we may be pivoting from some of that money that was put aside for broadband and bringing that into the housing space because of that need, because I don't think it makes sense for us to have the state to have $300 million sitting around waiting for supply chain issues when we could be putting that money to work more quickly in meeting some of the needs. One of the other aspects about housing is we developed a program called Commerce is calling it CHIP, Community Housing Infrastructure Program. Jefferson County got, or Port Townsend got $2 million in funding out of that fund. And the idea is to be able to put the sewer and the water or sidewalks and that infrastructure in to a given parcel, and then you could come in and develop the parcel for housing. A lot of the previous housing dollars were just for the units themselves, and they didn't cover that infrastructure need. And that helps us get more units available for more folks. So we'll be probably doing some pivoting within the supplemental budget. Just to give you a sense of the sort of ratios here, we had a $6 billion capital budget last year. We have about 84 million in capacity right now. So that's a huge differential. That maybe by moving some money around and backfilling on some of the projects that have supply chain problems and looking at what might be coming out of the federal government, we'll be able to address some of that. And I'll leave Mike, I think, to maybe talk a little bit about some of the public safety issues we dealt with and the tweaks that we're going to have to do to that. In the news the last couple of days has been this issue around the Washington Cares Fund, who folks may be familiar with that. It's a long-term care program. It was the first in the nation, and whenever you are the first doing something, problems arise. As folks may know, we passed this legislation in 2019, and it was going to start collecting the employee tax in January. But there's some challenges there, quite frankly. The need is paramount. Most folks, over 50% of the folks that are retiring have no savings. And all of us are living longer, so all of us are going to need long-term care. a lot of folks feel that Medicare and Medicaid will pay for long-term care services. They don't. Medicaid will, if you spend down to about $2,000 in equity. So you basically have to make yourself pure poor to be able to access those funding. So the need for this kind of long-term care structured savings account is important. We just maybe haven't got it quite right. There's some equity and fairness issues around folks that would have to pay in that wouldn't be able, because it takes 10 years to vest. So if you're 60 or 50, 57 and you're paying in, you wouldn't be able to really access it if you retire at 65. So we need to look at that. We need to look at folks that are working in state and living out of state. But there was a letter sent by the Senate Majority Caucus to the governor and the House leadership. We've been talking with the governor. So there's a strong chance that we may suspend this for a year to adjust some of the things that need to be adjusted and come back and initiate it a year from now. There's no question that the need is there. We just maybe don't have that program totally figured out the way to make it as fair and just as it needs to be. So I will probably leave it there, and hopefully we'll get into more issues based on what your questions are. But that's kind of a quick overflight of what's been going on and what will maybe be happening in the next couple months. So I'll turn it over to Mike at this point.
Thanks, everyone. Thanks for being here. I actually had another meeting today, and so I'm actually, pulled off to the side of the road and back seat of my car. So if I lose you, I'll dial back in. But it's one of the one of the advantages is we've learned we can have, be on the way to one meeting and stop and have a meeting. So Steve did a great job. He always does. We're really fortunate. He's serving on the chair of the capital budget, but also serves on appropriations. So he really delves into the budget for us. And I think, the overall trajectory for our district, and to remind folks, we represent all of Jefferson County, all of Clallam County, and with the new redistricting maps, we're going to be representing most of Grays Harbor County. We already have represented Ocean Shores, Hoquiam, cities of Elma and McCleary, and it looks like we're going to pick up the city of Montesano and a good portion of Aberdeen. So we obviously have a big district, and with three of us, Senator Vandeweghe as well, we try to divide, Steve's an expert, maybe more on the budget and capital issues, and the rest of us have our areas of interest. Fortunately, Senator Vandeweghe and I chair comparable committees in the House and Senate, primarily around agriculture, natural resource issues, and some rural economic development. And so he and I get to work in tandem. I think people forget sometimes that the natural resource-based economy is still alive and well on the North Olympic Peninsula, and in fact is still one of our primary private sector drivers. And you all in Jefferson County, obviously you have the paper mill, but we have a number of timber, active timber companies, active farms, active ranches, and there's a lot of issues that percolate around those. And so with Senator Vandeweghe and I in position, we can work with state agencies. Sometimes those state agencies want to come in and kind of rewrite rules through the process and the legislature has to say, no, we're going to go through the legislative process. So this last year, I think the most important piece of legislation that we passed was a comprehensive wildfire prevention and action bill. The number 2 emitter for carbon in Washington state has been wildfire. Obviously with the summer, not this last summer, if you noticed, but the summers before, we were really inundated with a lot of wildfire smoke. This last summer, even though it was as hot as it was, we did better because of this new bill that allows the Department of Natural Resource and other state agencies. We put some new equipment in place. We put some new policies in place. And they were really able to put out a lot of wildfires, especially east of the mountains, before they got to be catastrophic. Now, there were still a couple that were larger than they would like. But in saving those forests, we saved jobs in the rural communities. We saved the impacts on climate change with releasing all that carbon. And we saved the air quality on the North Olympic Peninsula. And even though and I also, Senator Vandaway and I worked on a drought committee this year. And while we had devastating drought in some areas of the state, and we had our forests as dry as ever, at the end of the day, our air quality was pretty okay. And a lot of it was looking at how do we put out these fires quicker, and are there forest management practices that we can go in and thin some areas of the forest before they burn. And once a forest burns, we know that wood can't really go to market. We know that carbon has been released into the atmosphere, and we know that rural communities have been devastated. So those are some areas in our committee. A couple of funny things. I mean, we're looking at the crab fishery, which is so important to the south end of our district down in Grays Harbor, but also you have a thriving fisheries out of Port Townsend and out of Clallam County. The coastal crab fishery last year was delayed, about 6 weeks on an issue called domatic acid. So domatic acid has to do with ocean conditions. It can get into the middle of the crab, kind of the heart of the crab. And so we really had a devastating impact on our coastal fishery. We're working on legislation that would allow crabs to still be harvested with high levels of domatic acid. And what they would do is then they would eviscerate the middle of the crab at the cannery and still move the legs to market. So that crab could, because what happens is they don't always know that these crabs are impacted by this acid and by this, and so we threw out millions of tons of crab last year, devastated the Quinault Indian Nation, which is crabbing is a huge part of their cultural and economic heritage. And a lot of private sector crab fisheries had to just literally throw out their product. So we're working on a way that they could cut out the middle of the crab, still send the crab legs to market. Quite frankly, crab legs are where the market is anyway. And so, it's little things like that, good government bills. It's not going to change the world unless you're a crab fisher, unless you're one of the Indian nations that we representing 6 of them. It's a big issue. And so sometimes it's just good policy, good government, people looking at these issues saying, hey, how can we make this a little better for our district? So definitely want to get to your questions, but I do, there's a whole host, we could sit here, Steve and I could both sit here and talk to you for 2 hours, on the issues that we individually worked on and that the legislature worked on. And remember, we're trying to govern. I know there's so much criticism these days. I mean, generally people are just not happy with politicians, and the legislature gets a lot of criticism. Pull up our emails on a public records request. We get criticized a lot. I do have to remind everybody, it's not an excuse, it's not a defense, but we are governing a very complicated 21st century society based on rules and timeframes and deadlines set in the 1800s. And there's not many other industries. There are companies that go back to the 1800s, General Electric and Procter and Gamble, but I can guarantee you they are not governing their companies still based on the original rules and policies in place. So the idea of a part-time legislature meeting for 4 months, trying to write a state budget for 2 years, in 2019 or the 2020, the last biennium, right? We left town and then COVID hit like right away. And we had set a 2-year budget, and then the whole 2-year budget was and so part of it is that it's a challenge that we don't always meet year round. We don't, some people would say, great, we don't want you to meet, but we are trying to govern. And I think for Steve and I, doing this kind of full time, this is our full focus. He and I spend a lot of time on the road together. We're traveling around the district, but we are trying to govern a pretty complex modern society. And then newsflash, not everybody agrees in our district, and not everybody agrees in our town. And we do represent, Grays Harbor doesn't always agree with how maybe folks in Jefferson County want to see things. So we have to kind of navigate a complicated society in a challenging way. So I get the criticism, and we'll hear a lot of it. But I would say that, in our case, Steve and I think, just the fact that we put in the road miles, and he and I had a chance to spend a whole day in Grays Harbor recently. And, that's invaluable to kind of spend 2 or 3 hours. So 3-hour drive. We started today at what, 8 o'clock, 9 o'clock in the morning in Westport. I met him by Fat Smitty's. Just giving you an insight in kind of what the job entails. So you drive for 3 hours. We meet with with Westport Yachts. We meet with the port, the PUD, the port of Grays Harbor, some city folks in Montesano, some union folks who had some concerns with how state agent, state bill, state policy. You learn a lot. You just learn a lot through all those conversations, and then you kind of weigh it in the back of your mind when these policies come up. And like Steve said, we have to amend maybe and change some policies. It's not cut or dried. Does that make sense? And I think, I would, well, let's get to your questions, but I just want to let you know, it's not like we just sit behind our computer screen and just pontificate about how we think the world should be. I think we work really hard on behalf of the district. So
thank you both. I want to remind you to put your questions in the chat because I'm not seeing them there. And I'm going to start with a couple of questions that came in while we were speaking on Facebook. And a whole slew of them, people have obviously been in touch with the news this morning on redistricting. So it looks like that's going to go through. And I know you spoke a little bit about how that's going to affect us locally. And maybe there's more that you want to say about that.
Yeah, I mean, I saw the same. I got the email this morning that the court basically said the redistricting commission did their job. And so the court's kind of declining to weigh in. They're going to accept the maps. And like I said, it makes our district bigger. I mean, it doesn't, a lot of districts in the I-5 corridor are going to get a little smaller. There's some districts in the I-5, they can literally walk around their district, in a day. I had one representative, she says she doorbelled her whole district, twice in the last campaign. But we will pick up more of Grays Harbor, and Montesano and part of Aberdeen. And the challenges in Grays Harbor are similar, and yet, man, they can also be very challenging compared to Port Townsend. But we'll do our best. One good thing we had asked, we met with the three of us met with the redistricting commission, and there were some initial maps that gave us North Mason, or maybe across the bridge from, around Kingston. And I think we just asked, kind of try to keep it to the 3 counties that we currently represent. Anytime you start adding more counties, that's more ports, more county commissions. Right now we kind of have an idea, the 3 counties and the issues, but, I think that the map looks pretty good for our district.
Good to know. I'm looking for more questions in the chat here. There's a thank you, and we echo that, I'm sure all of us, for letting the local PUDs be ISPs, and this is a fabulous opportunity. So much thanks to you from the group here. There's a couple of questions. One of them is housing. Let's just continue that dialogue. Not one of them, about 6 of them. So what funds are available to rural areas to help with our really serious workforce housing problems? It seems all the grants and government funding go to major metros in areas with over 100,000 residents. Help.
Yeah, so I touched on this a little bit, and East Jefferson and this community does well because they coordinate the effort. The chamber's involved, the port's involved, the PUD's involved, the city and the county, and of course the nonprofits that are working in housing. That unified message, you don't know, I get questions when I'm doing these questions on housing around the state, quite frankly, from people from the east side in Republican districts. They say, my representative doesn't support these programs. How do I get them done? And the advantage that this community has is the community gets together, figures out some prioritizations, and moves forward. That makes our job a lot easier, makes my job as a capital budget person a lot easier. So we've got, as I mentioned, we've got this community housing infrastructure program that is going to help open up some properties around East Jefferson for housing. I think it's always a challenge because we want these projects now, but they take, their construction projects, their infrastructure projects, it takes 2 to 3 years before they get done. But Port Townsend's they're working on, a sewer line and water line to service that area off Rainier there down by, where they're focusing on units, and there could be up to 100 units there, I think, within the next few years. We put money into the Hadlock sewer. We put about 15 million in that to get them across the finish line. That infrastructure will provide, the basis for a more broad-based, diverse housings sort of menu, if you will, choices for folks, both for homelessness, workforce housing, but having that infrastructure in there really opens up those opportunities. There's other dollars available mostly through commerce. There's a community housing, the small community housing piece. There's and then the bigger dollars that rural communities aren't really competitive on is the big supportive housing projects. Those are, huge projects that need tax credits and new market tax credits. And it's a pretty sophisticated funding sort of formula. So I think focusing on the smaller infrastructure issues and the smaller community housing pieces are, I think, where the rural communities can do. But we did, we put I think 420,000 into the Holy Caps project up there, Seventh Haven, I think it's, and that kind of got that over the finish line. And that's another example of where the community really came together. A lot of different folks were involved in that. There's not a silver bullet on this issue, but as we work on it bit by bit, I think we'll make progress.
So we're going to migrate, thank you. So we're going to migrate to a question from Scott Mock, who's our superintendent of schools in Chimacum, who wants to know what your thinking is about the long-term impacts of COVID on our students and families. And that's a huge issue here. So how do you feel about that? What are we doing to address that? What kind of formulas are going to make this work with salary regionalization? And there's a whole parcel of challenges we have for teachers and housing and salaries. And how can you in government in Washington help all of our schools?
Well, I guess I'll start out on this and let Mike add his insights. Obviously COVID has had impacts on business and economic activity, but I think the greatest impact has been on education. It's been super challenging, I think, for teachers themselves, certainly for the students. And the behavioral health issue is very real for students. And I think embracing that, not hiding it, not stigmatizing it, but just being very aware of it is important. So I think what we're doing at the state level is providing funding, as I mentioned, for more counselors, more clinics, more healthcare access within the school districts. And the good news is the operating budget is pretty robust. Our revenue picture, quite frankly, because we have a huge sales tax component to our revenue, is doing quite well. We've got a fair amount of dollars within the revenue picture to be able to make investments in this supplemental budget, which is quite unusual. And I think you will see quite a few investments in K-12 in that area of behavioral health and counselors. Again, there's a challenge, though, as most people probably on this call realize, workforce is a challenge. Having the slots and having the money available doesn't assure you of getting the people to do the work. And so everybody, I think that Mike mentioned when we were down in Grace Harbor, everyone we talked to, whether it was the hospital, whether it was Westport Boats, whether it was the PUD, everyone is looking for people to do work. And I'm sure folks on this call are experiencing that if you're but that's the challenge. And I think as far as education goes, looking at programs at the high school level that maybe get things started a little bit more to get get students on career paths, you know, is, technical education, career technical education, focusing on that, focusing on skill centers in nursing, in the trades, I think will help us meet that challenge in workforce. And I think it's a multi-challenge, right? It's not any one thing. I think demographics, excuse me, have a lot to do with it. People are retiring. I think the virus and that sort of 2-year hiatus made people realize maybe there's a different way to live their lives instead of working 60 hours a week or having a little more independence. That's part of it. I think people were able to save some money, so that's part of it. And I think there's just a lot of different factors that are going into that. But getting the education system to pivot to some of that career and technical focus, and focusing on counseling and behavioral health and addressing the things that were that have developed. Kids aren't socializing; they aren't having that interaction that I think we all crave, and I think also helps us stay a little more sane than just sitting in front of our screens for 8 hours, 10 hours a day.
Mike?
Yeah, that's a really good, it's a really tough question, and I'm not qualified to answer as far as this, the impacts. I guess I'm going to look forward. I'm glad about 2 things or 3. I'm glad about a number of things. I'm glad that kids, if their parents and think it's best, I'm glad that kids are now eligible to get vaccinated. I'm glad our president this week, twice, I heard him say he's not looking at shutting down, locking down, and keeping kids out of school. In fact, this morning in his comments, he reiterated the importance of making sure that our kids are in school, in-person learning, and he's not interested in going back to. So I think leadership at the top, making those strong statements of we're going to keep our economy open, we're going to beat the virus, we're going to get vaccinated, our kids are going to get vaccinated. He also said that he's going to open up families, places where families can go and get vaccinated together, all with the idea of keeping our schools open. I think that message, that was, to me, that was really reassuring, and I really appreciate it. He'll get a lot of pushback, I'm sure, from people who disagree. But my feeling is I think he's on the right track. We put a lot of money, and I wouldn't say we, it's not, Steve and I have houses, so we pay our property tax, but you all allowed the legislature, agreed with the legislature's position to put a lot of new money into education, to fulfill the court's decision that as the paramount duty in the Washington State Constitution, a public education is the primary duty of Washington State. The court then said when we put a lot of new money, public taxpayer dollars into that we had fulfilled our duty, but nobody thinks we got it again. In governing a complicated, and we made this decision before COVID, so in governing a more complicated society that just got more complicated the last 2 years, we've continued to look at the policy that funds education. I've tried to listen to teachers, listen to superintendents. Steve and I recently met with your superintendents, Jefferson County, and had a nice discussion with them for about an hour and a half. And they fed us a wonderful meal that the school in Port Townsend put together. But I mean, I'm not an expert. You're all the education folks are the experts. So we listen to them. We try to amend the policy. Is it perfect? Are we funding education perfectly? No, but we are doing a much better job than say we were 10 years ago. And we made a commitment. And then again, I think we all should be committed to our kids to in-class learning. I can't imagine. I have 2 boys, and they recently, they both graduated from college just as COVID, the last one, just as COVID was hitting. And I know we've had a lot of discussions, and even over Thanksgiving with some other cousins there, and all of them indicated how devastating that would have been through their high school career. Both of them were athletes. Both of them were college athletes. How devastating, that would have been to be in college and have your athletic career, your academic career shut down, stare at a computer screen. I mean, that's going to have scarred and changed some kids that we probably aren't going to ever know. I mean, it's going to take sociologists or whoever the experts are years to figure out the damage but you get 4 years of high school if you've lost a year and a half. If you're a high school, whatever. I mean, so that's, again, really appreciated President Biden's comments today. In class learning is his focus, and I completely agree with that.
Thank you both. We're going to pivot to greatly now to a healthcare question. And it's a very lengthy question, but and I'm going to sort of paraphrase this, but there's a lot of people going through the same thing. People that have insurance, that have medical emergencies that run up huge bills that, I mean, even with insurance, they can't pay and have to declare bankruptcy. And the questions relative to that whole Washington Healthcare Trust, which would provide universal comprehensive healthcare to all Washington state residents. And I know that some of you support that. They're wondering, particularly, I think State Representative Tharinger signed off on that ballot initiative. And so I'm wondering if you'd like to speak to that and why you support it and where it's going.
Yeah, I mean, it's a vision. We're a ways from the reality of getting there. What we've been trying to do at the state level is just improve healthcare sort of access, transparency on, network billing and out of network billing, drug transparency, what's generating those prices, and just trying to open up the black box, if you will, of healthcare to find out where the costs are and see if we can control the costs. I think that, as I had a discussion with Eric Lewis. Folks may know who Eric was. He was the CEO of OMC for a long Olympic Medical Center in Port Angeles, and kind of a leader in rural healthcare. He's now retired from that position and works for the Washington Hospital Association. He is an accountant by trade, and I think he's working with them in that capacity. But he's been in healthcare for, 35 years and really a leader. And talking to him, and then yesterday I was on the phone with Josh Martin, who runs Summit Healthcare in Alma. The long-term vision for healthcare is wellness. We need to get upstream of, get away from our healthcare system responds to the pain, responds to the health crisis. It's not geared to keep people well. And so there's, I think the virus and the focus on public health has been a value, sort of a silver lining, if you will. Universal health plan is going to be super expensive, and have whatever that revenue stream is to pay for that, whether it's a payroll tax, whether it's some sort of premium somewhere, is going to be super expensive if we can't drive down costs. And one of the ways to drive down those costs is wellness. Also, we're looking at the Build Back Better bill, which is trying to get CMS, Medicare and Medicaid, the ability to negotiate drug prices. I mean, it's crazy that they don't get to do that. The Veterans Associations, people know, Veterans Department, they get to do that. And CMS should be able to do that. So I think it's an approach. I think universal healthcare is the vision, but I think we need to we're working on incremental steps on transparency, billing, checking out, looking at hospitals. I mean, if you look at articles, in the healthcare world, the discrepancy between one hospital and another on what they would bill for, say, a colonoscopy or for sort of a standard procedure can be up to $8,000–9,000. And so it's all tied into this different insurance plans. They try to get the commercial folks to pay for what they're not getting in Medicare and Medicaid, yet in our area, Medicare and Medicaid make up over half of what, in some places, 80% of what, is paying for the bills. So there's a gap of about 20%. So again, I think the universal healthcare is a vision and it's a good one, and that's why I sign on to it. But there's a lot of different other areas we just need to work on to manage costs and work on wellness to be able to make healthcare more, affordable for all of us.
Yeah, I'll just add, I was recently at a healthcare meeting in Ocean Shores with the CEO of the Grace Harbor Community Hospital and the vice president that runs a clinic in Ocean Shores, and that community they want a new hospital, and it was a pretty frustrating meeting because they, you look at how much new clinics cost, and you look at how little Medicare and Medicaid reimburse the hospital's costs, and you realize, one of the goals is we've got to have more people in the system with health insurance that covers the cost a little more. So to build a hospital in a small community like Ocean Shores is just not feasible. I also think that one of the goals has to be, like Steve said, we have to make sure that everybody who wants health, everybody has an ability, and we've expanded the Obamacare program in Washington State. More people are on the Washington State plan. But after this meeting, a lady walks up to me and she says, I'm on the Washington Apple plan. I don't pay anything out of it, but nobody in Grace Harbor takes the plan because your reimbursement rates are so low. So here's somebody who's getting, in essence, universal, she's getting healthcare because she's on low income, but she literally has to drive into Olympia to find someone who will take her plan. So it's not just getting people on a plan, it's making sure that plan pays the cost. So the plan, when she would go to the hospital, I called him later and he said, yeah, that plan only pays about 58 cents on the dollar of service that I provide. And I have to limit the number of people that I can accept into my hospital. I can't service everybody when the plan only covers. So it's not just the health insurance. We have to make sure the health insurance would actually cover the hospital costs. And this is a public hospital. It's not like for some of these private hospitals, there's a lot of complaint about, the multi-million-dollar salaries that the CEO makes. Great complaint. We don't have that in the North Olympic Peninsula. These are public hospitals who make public salaries. So it's a two-pronged approach, and I support working on both of them. The third piece to that is, where does the revenue come from? Who do we tax? Do we raise your property tax? Do we raise sales tax? Do we raise small business tax? Do we raise the capital gains tax that was just recently enacted to pay for childcare and early learning? Do we implement an income tax? Do we do we value add? And until the public steps forward and says, we want this service and we're willing to be taxed for it, you kind of leave us in a tough spot. Every politician, everybody running for office, Republicans, Democrats, Independents, are all going to say, we want more access to healthcare. We want more people to be on healthcare. We want more reimbursements to the hospital. The rub is, where does the money come from? So until the public says we want the service and we want, if you tax us this way, we're jammed up. I think Steve's been a leader in progressive tax reform, and we did implement a capital gains tax. Has been implemented to pay for early learning and childcare. That was a priority. The legislature said that's the first thing we want to implement. If we implement a capital gains tax, is early learning and childcare for working families. It could have easily been, that money could have easily gone to more healthcare. It was a decision the legislature made. I think if this capital gains tax generates the kind of revenue that it says that we think it can in a state as prosperous as Washington, maybe some of that revenue could go to pay better reimbursement rates for healthcare. But it all has to do with, nobody's going to deliver a service if they're not being reimbursed adequately. And we're in a tough spot on the peninsula because we have so few private employers that have health insurance, that so many people are on the Washington plan already or on Medicare. You see in federal government, they're trying to lower the age to Medicare, the Bernie Sanders plan. They can't even pass that in Congress, and they can print money. They can deficit spend. They can pass bills that are $3 trillion tax cuts. And if they can't lower the Medicare wage when they can print money, Washington's kind of jammed up here. tough issue. Definitely support. It's not fair. Look, there's a fairness issue. You all pay to make sure that I have health care. I get a really good health care plan through Washington State, through our compensation. It's not fair that other people in my district don't have access to the same plan. I agree with that. That actually bothers me. And if there was, we can get into old philosophical, why do politicians get paid a better wage and better benefits than the people they represent? We need to change that.
Thank you both for that. That's unfortunately really true. So we have a couple more questions floating through here. One of them, we have the PUD on the call, so they're thanking you very much and hope that you will support the Hansen bill, HB 1336, because without that bill passing, the funding to build broadband out here just isn't going to happen. So we know that you do support that, and we thank you for all that you do. The next question is exceptionally lengthy, and it also is mirroring a lot of what is coming in through YouTube and the chat, and that is that there are a lot of restaurants and bakeries and theaters and movie theaters and shops and small businesses owned by the people who live here, and it was challenging before the pandemic to find employees because of housing, and now, as we were talking before this session, now it's virtually impossible. And businesses are going out of business. Owners are working themselves into the ground. Very few of them are able to provide, as you stated, healthcare for employees. So they go uninsured, some of them, which is damaging to all of our systems. I know that you've just spoken tremendously to the universal healthcare issue, which all of us truly are anxious to see happen in one form or another, but understand the challenges in doing that. What else do you think? How can we locally, you've said that you guys need to do this. How can the local people make a difference in what you're doing relative to this serious issue?
Stay healthy. As Mike sort of alluded to, and we have, the Cascade Care, which is a state subsidized, healthcare plan that you can buy through the exchange. But as Mike said, there's one thing having insurance. There's the other thing that, people are going to accept. It'll be a network that people accept the insurance. The providers will, accept the insurance. So and if you look at, I think, states that have tried it, whether it was Vermont or California, they got very, very close. And as Mike sort of alluded to, the costs made it, prohibitive. And I know the proponents, and Judy certainly is one of those, look at the reduction in administrative costs for all the insurance. And that's true. If you do that on paper, it works out to a certain degree. But the reality is that the system's a little more complex than that. And so on a local level, I think, other than forming your own sort of cooperative health plan that's tied into the providers, and you get buy-in from Jefferson Healthcare, and the other local providers, it's very, very challenging to as a community do that. I'm sure there's examples of where there's individual communities that have maybe figured out a way to cover their costs, but I think, as Mike also alluded to, a lot of the reform has to come from the federal level, whether it be drug pricing, for example, whether it be issues around transparency within the billing networks and things like that, because you get caught up in interstate commerce clause challenges if you start doing one thing in one state and it's not happening in another state. So I think this is sadly an incremental approach to getting the changes. And I think a huge change would be if we can get CMS to be able to negotiate drug prices. So, I mean, there's a program in Maryland. It's called Global. I think it's called Global Healthcare, and they kind of deal with CMS, where CMS just gave them a sum, and they get to keep that sum no matter what the costs are, no matter what they bill against that sum. And they got upstream. They really promoted health. And so there was less demand in the ER and less demand for expensive services. They were able to keep that differential, right, of the money that was allotted to them, and they reinvested that in their communities for healthcare. And I mean, if you look to, and the numbers are astounding. I mean, there are hundreds of millions of dollars that they were able to save by getting upstream on the wellness piece. And again, as I said earlier, that's really where we need to go, to get to focusing on wellness and not just dealing with sickness, not just dealing with the health crisis, but starting to promote wellness.
I wish, these are those moments where it'd be really easy to just say, yep, we're going to work on it. We'll fix it. No problem. But I can't do that. I don't think Steve can either. I wish these could be solved with Senate Bill 8852. But Senate Bill 8852 will be anywhere from 2 pages to maybe 25 pages. And these are complicated issues. It just can't be solved with one piece of legislation. You also have legislators from different districts. So what we face on the North Olympic Peninsula is vastly different challenges than what they're facing in the representative from Capitol Hill or the representative from South Seattle and or Federal Way or Kent or Grant County, wheat country, east of the mountain. So we all bring our perspectives from our districts, and then we have to try to craft policies that work statewide. The other thing, and again, it may not be fair that I have health care, but I've been turned down. I recently tried to make an appointment with a doctor, and he didn't accept the state plan that I have. The other thing too is I challenge you to walk into any medical clinic right now, or the hospital, or a dentist office, and find out where their staffing is. My son's a recruiter for Olympic Medical Center. They actually have recruiters. The Olympic Medical Center's hundreds of positions open currently. Most of your Grays Harbor Community Hospital has many, many positions. We are losing more people than we're gaining in the healthcare. We're, especially through COVID, people are leaving the career. We heard of a program that we were, trying to train some social care workers at the high school in Elma, and they had a number of kids signed up, but they couldn't find an instructor. And the colleges are trying to find instructors. We are in. I would argue we may be in a paradigm that none of us ever predicted. I think Steve and I have been in public office well over 2 decades. For the vast majority of our time together as county commissioners and now state reps, for the vast majority, it was like, create jobs. We need more jobs. We have too many people who can't find a good paying job. And since during COVID, that script has flipped. These are $50,000 to $80,000 a year jobs at Olympic Medical Center that are wide open. Your small businesses have tried to raise. I've talked to a number of small businesses that said $15 an hour. We used to get criticized by small business because we had such a high minimum wage. Now they're like $15 an hour. I'm trying to offer 20, 22 an hour, and I can't find people to work. So the script is flipped, and I got to be honest, I don't know what the answer is to that. I don't know if it's, and for small businesses losing people, I feel for, if we can't find people in the healthcare facility, at $80,000 a year. My son was like, I was talking to a nurse trying to recruit her from another state. We were going to offer $85,000 a year to come live on the North Olympic Peninsula. Well, she came and visited. She couldn't find a house. And she's like, I'll just stay where I'm at, you know, $45,000 a year. At least I have a house. So these are complicated issues. And, you know, that concern is not the same concern maybe in other parts of the state, but it is a concern. So I'll be honest, I don't know what the answers are on this new script. I know for my paradigm has always been, let's create more jobs because we have way more workers than we have jobs in this. You know, it appears to be not, that does not appear to be the case. It's actually, you know, you all tell me how that happened.
We are in difficult times for sure, and I don't think any of us have answers or expect you guys to have this magic wand that you can wave, money or no money, to change this with any speed. But thank you so much for your input on that. We do have a couple of more questions, so we're going to pivot hugely now. Let's talk trees. We have a couple of questions that came in on Facebook on logging and climate change. So the overarching question is about carbon capture capacity science and clear cutting. So if either of you would like to speak to that logging issue, I mean, it's a huge thing in Washington State, and a lot of the questions come in about the optics of clear cutting, but some of them are about the carbon footprint. So perhaps you guys would like to speak to that and to what government is doing and to trying to help on both these ends.
Yeah, this is a very interesting question, actually. We're starting to, well, there are two parts. Let's talk about the clear cutting first. Washington has probably some of the strictest forest practice laws in the world. And, you know, the commercial harvesters feel that clear cutting is still a pretty effective way for them, but they have to provide a lot of setbacks and a lot of other requirements. You know, so the clear cutting may be insightful. I think you know, certainly that cut around on 104 is not pretty, but in, you know, in the bigger context of forest management, it makes sense to the commercial boys for replanting mainly. The carbon sequestration issue, I was actually, as folks may know, I've been a kind of a proponent within the capital budget for something that's called mass timber or cross-laminated timber, which is using wood, huge wood panels for wood construction. So every, you know, when you have the forest growing, you know, it's sequestering carbon. And then the idea is that when you harvest the wood, you use wood for buildings, and that continues to sequester the carbon. So basically a cubic yard of wood sequesters about a ton of carbon. And I was at a demonstration site actually on Monday where this group Forterra, some folks may be familiar with that nonprofit, they're working with a Swiss company to develop a plant for this cross-laminated timber, and they're building it a demonstration house. There's some huge advantages to this construction because you have these huge panels. You show up on site, they're all cut to, you know, within a millimeter tolerance, and they can assemble a house in a week, start to finish. They just bring in the Legos, if you will, the wood panels, the HVAC, the electrical, all that just fits together and boom, boom, boom. And you've got this, you know, structure that's pretty aesthetic and, you know, is sequestering carbon. During that tour, there was the guy from Microsoft happened to be there because he was kind of interested, head of their climate fund. And Microsoft is trying not only to be net carbon neutral by 2030, they want to be able to be carbon neutral retroactively. So they're going to try to cover all their carbon impacts from their inception. But he said that one of their challenges and one of the things they're working on is software to determine those carbon offsets, if you will. And he said he gets 2 or 3 people a week, other businesses coming to him, help us with this. We don't know how to do this. And so they're trying to develop the software that will be an important piece to have sort of a standardized calculation software, if you will, that will be able to provide data, accepted data across the marketplace for carbon sequestration. I toured, Nature Conservancy has a plot out on the Hoh River in West Jefferson where they have a reserve out there, and the way they're able to retire the purchasing price on that is their carbon sequestration. They're able to sell those credits into California right now. But it's a pretty sophisticated challenge because they have to measure the trees at the standard, and then as they grow, and then figure out how much, excuse me, how much carbon is in that. So it's pretty exciting that Microsoft is getting involved in this and is developing some software that will provide that standardization and hopefully a program that can do those calculations. Because once you get some standardized calculations across the marketplace, I think it'll strengthen the ability to have carbon sequestration as an ecosystem value, if you will, that can be added to the forest. So it's kind of an exciting time in this area, and I think Washington will be a leader in that.
For sure, Mike.
Yeah, well, I hope it may not be, and maybe I'm misreading how the question was characterized. It did appear maybe there's kind of an anti-timber harvesting question. Two things: trees do a great job of sequestering carbon, and unless that wood burns, which forests that aren't managed tend to burn more than forests that are managed, that carbon can be sequestered forever. So when it goes into furniture, a house, and wood generates less carbon footprint than cement and steel buildings. And so the more higher rise buildings we can build out of wood, the more carbon has been permanently sequestered unless that building burns. But we do know the forests eventually will burn. Number two, we could, there is a possibility a legislature down the road bans all forest harvesting in the state. And so that clear cut you see on 104 will be a housing tract down the road, because the private owners of that land are going to do something to manage and to get a rate of return. The state lands, if they were permanently locked up, then we're going to have to tax you to make up for the difference in lost revenue to the school trusts. So this is Washington State, and Washington State, like Steve said, has arguably the most strict environmental policies on forests, on other plants, we have people who want to build new factories here are really running into, they really basically can't. So what they've done, I've talked to a couple of companies that were looking at siting plants in Washington. They're like, yeah, we're going to go to Idaho. So if you don't think that the carbon footprint from the Idaho not having, policies in place, you think that the climate, I wish it, the last time I checked, climate change doesn't stop at the border of Washington State. So instead of denigrating or being critical of how Washington State is allowing our plants to be sited, our mills to be sited, our trees to be harvested, understanding that in a global economy, these companies and people and individuals have multiple choices of other states with little to no environmental regulations. If you're truly intellectually honest about climate change, you would be like, my gosh, we want to support the Washington timber. We want more timber companies to come to Washington and follow our rules, as opposed to other states that have, no disrespect, but Idaho, Wyoming, Montana, they don't really have a whole lot of forest practice rules other than the federal stuff. I mean, and you drive through Wyoming. How many people have driven through Wyoming recently? I mean, they got wells, they got gas, they got stuff belching into the air. You come over to Washington, we don't have that. And yet companies have tried to move because we are close to the water. We're close to ports. They've tried to cite it. We can go a little too far on this, but if you think that climate change can stop at our border, or the impacts of climate change are going to stop at our border, I think you're going to be disappointed. So, look, we're not going to probably be putting in, as long as Senator Vandeweghe and I are chairing the committee, a lot of new regulations, but we also haven't rolled back regulations. And so folks are living within the regulations that we have. to keep an industry. The other thing too, you know, your paper mill, they have proven to me and to Steve, they have proven that they've lowered their carbon footprint. They're using more recycled material. The paper mill in Port Angeles, trying to get up and running, is using recycled material from the I-5 corridor to build new product. They're trying to use more recycled material. We know that the cogeneration plant is taking, you know, is an alternative form of energy. These are challenging issues, but I'm actually pretty proud that Washington is a leader in our forests and fish. The 20 some odd year anniversary of Forests and Fish is coming up. Forests and Fish was groundbreaking policy in Washington state, and it has worked for over 2 decades, so that you haven't seen a lot of conversion from timberland into housing tracts. The other thing too, in a lot of counties, that timberland could be converted into a whole host of other issues that probably people would. And finally, here's my final point. And if you're intellectually honest about this issue, think of this. That clear cut you saw, that you see on, is at 104. You will, if you live here for the next 30 to 40 years, you will get the privilege and honor of watching a forest regenerate, regrow. And that's the last land use activity you'll see on that piece of land, as long as it stays as a working forest. Because most of us, I know I won't be around in the 60 years when it's harvested again. So we get the privilege of watching Mother Nature regenerate, but there's no pavement coming. There's no housing coming. It's a working forest, and you'll get to watch that forest regenerate. And I think that's that's the piece that people forget. You get a clear cut, and then that's it. That's it. They're going to replant, and then they're going to sit back. Talk about long-term investing. That's the ultimate long-term investing. They're going to sit back, they'll watch their trees grow, and that piece of property won't be developed. It's a working forest, and a working forest gets scalped about every 60 years. And the rest of the time, it's absorbing water, it's absorbing carbon, it's creating wildlife habitat, it's creating trails for recreation. I mean, there's a whole host of issues on that piece of property that we'll get to enjoy once we get through. Okay, I got it. It's like, I used to buzz my kids' hair, right? Buzz it, boom, especially, when they were younger, and they would complain. I'm like, guess what, guys, it'll grow back. And it did. Start of summer, buzz cut. Start of school, buzz cut. They hated it. They still talk about it. But I don't know. I hope people think about that, because if you can't cut trees, it's gonna be developed. And do we want that as well?
And I do want to give a shout out. Richard's still here from the Jefferson Land Trust. There, of course, the Chimicum Ridge project is a very interesting project. We've been able to support that at the state level. I think 2 different times we got about $3 million. And that's an interesting approach, that community of forest approach, where they balance selective harvest with ecosystem value, with recreation value. And so that will be, that's a model that's being tested as a more integrated model. And so that's something to watch. And I really appreciate the Jefferson Land Trust taking the lead on that. And I suppose a lot of folks on this call are familiar with that Chimicum Ridge project, but that's an exciting new approach, or different approach, or integrated approach to, forest and harvest and other uses, ecosystem values and other recreational values. So hats off to what they're doing at the Land Trust on that piece.
Thank you.
Thank both of you for that. This is Washington, and there are logging and tourism have been, the anchor for the state for a long time, whether they've been supported or not. And there are 50% of the people who love it and 50% of the people who hate it. And it's a love-hate relationship with all of this. So thank you for speaking to that, and for the tourism piece as well. You can see all the thank yous in the chat, and thank you both for all of what you do. We are grateful for that as a community, and for your long service to the community and commitment to Washington State. We greatly appreciate what you do. So please keep working on these issues, and And we hope you can come back more often, and at some point in the near future that you'll be with us in person again. We are very, very grateful. Thank you all who have joined us today, and for staying on this call. We appreciate it, and taking time out from your very busy schedules. The holidays are coming up. The Chamber's here to help you with that. Don't forget Toys for Tots. And most of all, we want you to stay safe and healthy, but during the holidays, think of supporting your friends and neighbors who are having tough times through this. And most importantly, please, to do that, shop local. Thank you so much to Representative Chapman, Representative Tharinger, and to all of you. Have a great day, rest of the week, and happy holidays.
Happy holidays, everybody. Thank you.
Bye, you all.
Yeah.